Good afternoon, good morning, everyone. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At the moment, all participants are in a listen-only mode. For those that are connected by telephone requiring operator assistance during the call, please press *0. For those online that require assistance, please use the chat box on your screen. I would like to now hand the meeting over to your host, Nitika Rewari, Manager of Prevention and Promotion at the Mental Health Commission of Canada. Please go ahead.
Thank you so much, and hello and welcome everyone, and good morning. Welcome to today's webinar by the Mental Health Commission of Canada on e-mental health and Indigenous partnerships in suicide prevention. Today's webinar is being presented to you by our guests from the Kids Help Phone. Kids Help Phone, for those of you who are new to this organization, is Canada's only 24/7 national support service of its kind, offering professional counseling, information, and referrals and volunteer-led text-based support to young people in both English and French. Thank you so much for our guests today to present. Before we begin, I would like to acknowledge that I am located in Ottawa on the unceded territory of the Anishinaabe Algonquin Nation. As those of you who are participating today are located across Canada, we do invite you to acknowledge the territory you are joining us from today in the chat box on your screen. Just to introduce myself as well, my name is Nitika Rewari, and I am a manager in the area of prevention and promotion at the Mental Health Commission of Canada. I've been with the Commission for close to 7.5 years now, and I'm very, very pleased to be joining you here. I am leading our efforts in the area of suicide prevention, and more specifically community-based interventions in suicide prevention. So very, very happy to be joining with you today. We're also pleased to be offering this webinar to you in both official languages. Today's webinar will be presented in English and simultaneously interpreted into French. You will be able to connect to the French audio by calling the telephone number that is displayed. If you're having any technical difficulties, please write in the chat and we will do our best to assist you ASAP. You will see that there are two presentations visible on your screen. On the left is the presentation in English, and on the right is the presentation in French. Depending on the size of your screen, some of the information on the slides may be hard to read during the presentations. If you would like to focus on the slides in your preferred language, you may make the presentation full screen. You may do so by clicking on the icon with the 4 arrows on the top right of the presentation. It is important to note that once you have made the presentation full screen, you may not be able to view the chat box. To return to the normal view, to view the chat box and ask questions, click the same icon with the 4 arrows on the top right of the presentation, and it should bring you back to the screen with the 2 presentations of English and French and the chat box again. Please feel free to ask your questions in the language of your choice at any time in the chat. Questions will be answered during the question and answer period at the end of the presentations today. For ease of reference, please indicate which speaker your question is directed to, or if your question applies to all the speakers. Finally, considering the topic of the presentation today, I invite you to take note of the distress line number for your region. We will put some additional information in the chat box as well. Please do not hesitate to reach out to your local crisis center or distress line for support if you feel that you need it. Our program manager, Uyen Ta, is also providing bilingual mental health first aid support during this meeting. If you would like to connect to Uyen, please reach out to her via email. That will come to you in your chat box as well. I would like to now introduce our speakers to you. Today we have the pleasure of hearing from 2 individuals who work to oversee child and youth initiatives at Kids Help Phone. First, welcome to Alyssa Simon, who is the Senior Vice President of Innovation and Chief Youth Officer at Kids Help Phone. Alyssa brings more than 20 years of leadership experience in healthcare to her position and drives improvements in service and support that respond to evolving technologies and the changing needs of young people. These include Kids Help Phone's live chat service, the Always There app, and crisis text line powered by Kids Help Phone. Next, we have Deanna Dunham, Director of Indigenous Initiatives and Equity Program at Kids Help Phone. For more than 20 years, Deanna has engaged with Indigenous audiences. Since 2018, Deanna has been thrilled to lead Kids Help Phone's Indigenous initiatives. In this role, she works under the guidance of an Indigenous Advisory Council to implement Finding Hope, Kids Help Phone's action plan for supporting First Nations, Inuit, and Métis young people. Welcome to you both today, and our webinar today will begin with the presentations from Alyssa. Over to you, Alyssa. I'm going to change the slides over to you now.
Thank you so much. It's fantastic to be here. Again, my name is Elisa Simon with Kids Help Phone. I do want to recognize that I am on the land, the traditional land of the Haudenosaunee and the Mississaugas of the Credit First Nation today. And I am going to talk a little bit about who Kids Help Phone is and what it is that we have been learning around suicide. And then I am thrilled to be here with my incredible colleague, Deanna, who's going to talk more about the work that we've been doing in partnership with Indigenous peoples and communities from coast to coast to coast around suicide prevention and just in general to ensure that we are better partners and better supporting Indigenous young people. So to begin with, we always start with a quote to just sort of ground ourselves in the people that we are serving and the reason that Kids Help Phone is even here. So I will give moment for people to be able to read that. And this service user is one of tens of thousands that reach out to our service every single year and who feel a sense of connection, hope, and feel less distressed as a result of the support and services that they receive through Kids Help Phone. So Kids Help Phone is a pioneer in virtual care and e-health solutions. In fact, we were sort of pioneers before we knew what those words were. We have been around for 32 years, and as was mentioned before, we continue to be the only national bilingual 24/7 resource for young people. We have lots of different services and supports, including professional counseling as well as volunteer support. But we also connect people to services in their community, provide tools and resources. And our real mission and vision is that every young person in distress should be able to quickly and easily reach the kind of support that they need. Last year, we supported young people 4.2 million times. That is a very large number. And to put that into some context, in 2019, we supported young people 1.9 million times. So we saw a significant increase last year in the number of young people reaching out to us for support. Every day, about 900 to 1,500 young people reach out to our one-on-one services. And so those are young people that we are having individual conversations about the challenges that they are facing. And we have seen those numbers double over the last year. And again, our mission is that every single one of those is answered, they're answered quickly, and they receive high quality, culturally appropriate services that is going to help them move forward. So although Kids Help Phone has been around for a very long time, the reality is that we have become more and more aware of the significant challenges young people are facing with mental health and well-being, and with what we would say is the severity and scale of a real crisis in Canada, which is we're seeing more young people in distress and more young people that are finding closed doors when they reach out for help. Either there's not services available in their community, there's not the most appropriate services, or there's tremendously long waiting lists. And so we have really been working with this vision that we call our innovation imperative, which is about how do we create a system and support virtually where every young person in Canada can access the support they need in the way they need it most. And this vision began about 2 years ago when we started saying, okay, the phone service or the chat service that we offer, that's not enough. We need to do more. We need to leverage technology. We need to leverage the ideas and input from young people to build a real system, a cohesive virtual system where young people can connect and support. So I know this slide is difficult to read. There's a lot of information on it, but this is just showing you a little bit about how we have been changing since 1989. And Kids Help Phone is an interesting organization in that we are very well known across Canada, but most people still think of us as we were in 1989 when we were a phone line. And we have been changing consistently since 1989 with a huge amount of change happening just in the last few years. And that has included that we started what remains the only national texting service for young people that is 24/7. Last year, we increased that texting service to be available for all adults. We also have been piloting providing our services in other languages. We started with Arabic last year, and we'll be moving into other languages this year. And this past year, we also piloted being able to connect young people who identify as Indigenous with Indigenous crisis responders in order to determine whether or not that has an impact on the quality of the interaction. But again, through the years, we have continuously been looking at what needs to come next. How do we recognize that young people are changing faster than ever? Technology is changing even faster. And in order for us to ensure that young people have the support they need, we have to be continuously thinking about what's next. And equally important, thinking about how the young people play a part in the code and development of what's next, so that it truly meets them. One of the other products released last year is called Data Insights. It can be found at kidshelpphone.ca. This is an insight into Kids Help Phone's data, because one of the things we realized is that we hear from more young people every single day in real time about the challenges they're facing. And so we have this tremendous amount of data. And we wanted to find a way to be able to provide insights to people across Canada, but also to young people themselves in order to potentially reduce the isolation that they feel around the challenges that they're facing so that they can see what other young people are connecting about. And so I invite you to go look at that. That was launched a few months ago, and it has Kids Help Phone's data as of last month. And we're currently working on version 2, which will have more to date to be able to share, as well as trends. So when we talk about young people reaching out to us, the list that is up there right now are the main issues that young people reach out to Kids Help Phone for. About 23% of all of our conversations are with young people who are discussing suicide. And so while it is not the number one reason that young people reach out, it is a significant part of all of our discussions. At Kids Help Phone, we have seen over 100% increase in conversations about suicide over the last 5 years. And I want to just take a moment to sit with that, because that to me is both incredibly concerning around what's happening across Canada. It is also, to me, a moment of real hope, because what it means is that when young people are thinking about or impacted by suicide, they are reaching out to us for support, which provides us this tremendous opportunity to actually be there for them and to get them the supports that they need. One of the ways that we support young people across the country, and now, as I said, adults, is through our texting service. And we have this incredible technology that triages high-risk texts so that if we all at once, we'll treat that currently about 92% accurate in triaging those people who text in about suicide to the very, very top. And we're that technology to make it even more sophisticated so everybody that is in need of very fast, quick service are getting connected first. I'm also really happy to say that this texting service is overseen by paid professionals, but the people that are actually answering are trained volunteers. And we currently have over 2,200 volunteers from every single province and territory that are responding to text, so that we get to about 99% of all of our texting conversations in under 1 minute. But this triaging is so critical for those times when it's very, very busy and maybe we will not get to you in 1 minute. We want to make sure to get to those conversations where there is suicidality as quickly as we can. I'm now showing you a slide with some different words. And the words, if we look at them as columns, these words represent a few different things. The first column that begins with the word bridge, those are the words most likely used when people are contacting the telephone and discussing suicide. The middle column that begins with overdose are the words that young people are most using when we are going to have to do an active rescue. So for those people that we're going to have to connect with emergency services to do an active rescue, they are most likely using those words in that middle column. And then the third column that begins with so, those are the words that we have found through our work have the largest de-escalating effect, so that when somebody is talking about suicide, those words are the ones that our crisis responders and counselors can use that seem to have the largest de-escalating effect with the young people connecting with us. And then some of our learnings around suicide. So again, when we look at what are the words that people use, we see that young people who use the word overdose are 3 times more likely to be suicidal and need an active rescue. People who use the word pills and jump are 2.5 times more likely. We also see that texters who mention ambulance are 4 times more likely to need an active rescue than who use the word suicide. And so the reason I'm sharing some of this with you is because we see there's just tremendous data and opportunities to understand how people are discussing suicide by looking into the words and the ways that they actually put those words together, which is some of the work that we'll be doing in the coming years. In terms of when people reach out to us about suicide, I actually just am noticing that there is an incorrect on there. Our suicidal conversations are most likely between Saturday and Monday. So disregard what is on that slide in terms of that. And they usually happen between 10 p.m. and 1 a.m. Again, the reason why that's so important is that young people are reaching out to us to talk about suicide when almost everything else is closed. And so it really highlights the importance of a 24/7 service. Other learning that we have had is when we look at those people who are reaching out in nonverbal ways, like texters versus chatters, we find that texters are 4.9 times more likely to discuss anxiety, 2.2 times more likely to discuss relationships, and 5.4 times more likely to be feeling depressed, and they are more likely to be talking about suicide in particular. We also know that our service is making a huge difference. We have, on average, we save about 9 lives every single day. For people that we are not able to keep safe through our conversation with them. And we also know through our evaluation that people that reach out to us feel much better afterwards. And so some of the data here, 82% are feeling less alone, less distressed, less upset, or more in control. We also know 59% are speaking to us about something they have never shared with anybody else. 7% say that if this service had not existed, they would not have done anything else. They would have ignored the issue. They would have hoped it got better. And 89% of those were actually talking to us about suicide. Also, we know 11% say they would have gone to an emergency room or a healthcare provider if we had not been there. I'm now going to turn the conversation over to Deanna to be able to dig more into the work that we've been doing with our Indigenous initiatives and why that work is so important.
Thanks, Elisa. Hi, everybody. Good morning. It's a pleasure to be here with you today. So before I begin with the slides, I'd like to start by saying that when we speak of First Nations wellness, we're talking about a person's mental, emotional, spiritual, and physical well-being. Each aspect of a person's well-being is connected to the others. It also is dependent on the well-being of an individual's community and their connection to lands and culture. So in terms of community health, it should be easy for everyone to appreciate how limited food security, safe housing, access to economic opportunities, clean water, education, healthcare, all have a strong impact on well-being. At Kids Help Phone, these factors can also have a direct impact on the accessibility of our services. So a young person may have access to a landline phone, but if they're living in a 4-room house with 11 people, they likely don't have the privacy to have a confidential conversation with one of our counselors. So in 2017, Kids Help Phone set a strategic objective to maximize access to services for all young people in Canada. Our board took this a step further by committing to develop a strategy specifically for First Nations, Inuit, and Métis young people. What's more important is that they put the resources behind it to set it up for success. We began by asking ourselves, what is Kids Help Phone's role in supporting Indigenous youth? The answer is very simple. Our role is to listen and learn from Indigenous people who are experts in their own lives and work with them in partnership to support not just the young people in their communities, but the communities as a whole. So in the next few minutes, I'll talk about how we, as a settler organization, work with Indigenous youth and communities to support life promotion. One of Kids Help Phone's core values is courage. It's my favorite of our values because, to me, it embodies the courage it takes for an organization to truly embrace leadership from others who may be new to the organization. And I'm referring here to Kids Help Phone's Indigenous Advisory Council. So after creating a management role that was dedicated to leading our Indigenous initiatives, we established an advisory council of First Nations, Inuit, and Métis individuals with a range of expertise related to our services. Half of the council are young people themselves, and there's cross-membership on our board and National Youth Council. The council bases their decisions on their own education and experience, but also on input we receive through ongoing engagement. So the decisions that the Indigenous Advisory Council makes, like I said, are informed by what we hear from communities, from partners in a variety of formats, and it's ongoing. So before I continue, I want to share a website address with you because I'm going to keep referring back to our website over and over again, and this is the page that I'm referring you to. It's kidshelpphone.ca/findinghope. So if you visit kidshelpphone.ca/findinghope, you'll be able to do things like subscribe to our Indigenous Initiatives Network. So this is an email distribution list where we reach out to anyone. It doesn't have to be an Indigenous person, but we reach out with opportunities for partnership and collaboration, and just to keep people informed about what's going on with Kids Help Phone's Indigenous initiatives. And a lot of people reach out to us and respond to those messages with great suggestions and connections and opportunities for partnership. It's really fantastic. I'll speak more in a bit about our Indigenous Engagement Program, but that's a network of individuals who volunteer in Indigenous communities who provide ongoing feedback on our work. So if we have something like a paid promotion campaign on social, that network might say, you know, this this really resonates with me, this one doesn't, and provide that kind of feedback as we go. We have ongoing partnerships and special projects with the Indigenous partners. And I wanted to flag one thing that we did right before COVID, because as we get some of these other engagement initiatives underway, we needed some input initially really to start us in a good way. And so we reached out through the Indigenous Initiatives Network to ask for communities who would like to partner with us to engage with the Indigenous youth in their communities to understand how they would like to be supported in their well-being. So we partnered with 8 communities to hold 11 sessions with around 180 young people from grade 4 to 12. And one of the key things we learned is, Elisa mentioned earlier that we have really good awareness across Canada. That's not true with Indigenous people. That's true of people, the general population. But we learned that very few Indigenous young people are aware of Kids Help Phone services. So it's something that we use to direct our outreach activities. Moving on. So Finding Hope is Kids Help Phone's action plan for supporting First Nations, Inuit, and Métis young people. It outlines 37 very specific actions and goals that we're committed to achieving. So I spoke earlier about supporting the well-being of Indigenous communities. The actions of Finding Hope go beyond service enhancements and awareness initiatives, which are both key aspects of the plan. But to give you a few examples of how they support communities, Action 10 outlines our commitment to sharing data back with Indigenous communities so that they can use it to inform their own strategies and access research funding. We apply OCAP principles to everything we do with Indigenous initiatives. I encourage you to connect with the First Nations Information Governance Center and learn about the OCAP principles, because when we collect information from Indigenous young people, and it is specific to First Nations, though we use these as guiding principles for all our Indigenous initiatives, it's important that we recognize that Indigenous people own that information and they need to have access to it. Action 32 of Finding Hope references our commitment to supporting Indigenous students as they transition into the workforce. And one last example, Action 36 speaks about how we're ensuring our procurement policies support Indigenous economies. In fact, many of the photos in this presentation, including this one, were licensed from Cree and Métis youth from the Pine House Photography Club. So instead of buying stock photos, we were able to showcase the incredible talents of these young photographers and put money back into local economy. Our partnership with Pine House Photography Club is very dear to us. We're really humbled by how much it meant to the young people to support their peers by contributing their photos. And you can actually read about it in their own words on our website. Finding Hope outlines 4 guiding principles, which I'll go over pretty quickly here, and I'll talk about recognizing and respecting the distinctiveness of Indigenous nations and communities on the next slide. But one of the goals of Finding Hope is to increase Indigenous representation among our staff and volunteers to 5%. It's important that Indigenous people are a key part of our organization. And we're currently undergoing an Indigenous workplace assessment by an Indigenous firm to support this goal. And although we'll undoubtedly surpass this goal through our upcoming volunteer program and our new Indigenous positions, it's important to us that Indigenous people are represented throughout the organization and across departments and in leadership positions. Education is ongoing. It's mandatory for all of our staff, but it takes place in a variety of forms. It's ongoing, and it reflects diverse Indigenous perspectives. The distinctions-based approach means that we recognize that what works for Inuit youth may not be helpful for First Nations and Métis youth. And we take a distinctions-based approach whenever possible throughout our work. So Elisa mentioned earlier that Indigenous youth can connect with Indigenous crisis responders through texting and Facebook Messenger. Well, we do that through a distinctions-based approach. So a First Nations young person or adult who wishes to connect with a crisis responder, a First Nations crisis responder, would just type the word First Nations at the start of the conversation. And that's true for Métis and Inuit people as well. Action 14 of Finding Hope talks about how we'll contribute to the revitalization of Indigenous languages. We're currently developing content and an interactive feature for a website that will be available in 10 Indigenous languages. We're also creating positions for Indigenous wellness specialists and engagement coordinators. So the wellness specialists will support counselor and crisis responder training to ensure everyone understands Inuit, First Nations, and Métis youth and the daily realities they face in different environments. I mentioned life promotion earlier, and I suspect many of you may be wondering what I meant. I prefer this term to suicide prevention, and I'll quote our friends at the Federation of Sovereign Indigenous Nations to explain why. So life promotion encompasses a positive energy and a philosophy for growth in self-love and empowerment. So reframing the language we use to speak about problems within our communities will shift focus to building on strengths. All of the initiatives that are underway, all of our Indigenous initiatives that are underway at Kids Help Phone promote life promotion in different ways. I mentioned the Indigenous Engagement Program before. So that is this network of volunteer champions and ambassadors in Indigenous communities who will help promote services in their communities, provide us with feedback and ongoing guidance for our work, and also help ensure resources in their communities are in our Resources Around Me database. But they're also going to give presentations in their communities and operate information booths. And the goal of the program is to really empower people to make a positive change in their communities. The Service Access Points Toolkit is a different initiative. So I mentioned at the beginning about about having crowded housing and how that may impact someone's ability to access our services. There are a number of things that can be barriers to accessing remote health services. So connectivity is another big one, or access to a device. So this Access Points Toolkit that we're developing is a partnership with communities across the country who will create spaces in their communities where people who don't have access can reach out for support to Kids Help Phone and to other remote health services. So as a group, we'll work together to create this toolkit, and then other communities would use that toolkit to create similar spaces in their communities. I'll touch also on our emergency referrals initiative. So we've been partnering with 11 First Nations in Saskatchewan for them to identify which emergency services we should connect their citizens to. So instead of automatically reaching out to the RCMP, recognizing that there are resources within communities that can get to people who are at risk of harm faster and in a more appropriate way, in a safe way. We are working with those communities to ensure that when we do have to engage in an emergency referral or an active rescue, that we do it in the best possible way. And lastly, I'll mention our Brighter Days program, because this is, we're launching Brighter Days next month, and we're really excited about this. This is a program that, where Kids Help Phone is there for people in that moment of crisis, we also want to be there long before they get to that position. So the Brighter Days program involves a First Nations wellness specialist or an Inuit wellness specialist or the Métis wellness specialist. It takes a distinctions-based approach, connecting with a group of young people, and it could be in a classroom, it could be at a friendship center or a youth group, to first build awareness of Kids Help Phone services in the first session. But our goal is to come back every few months and talk about things that are important or priority issues in those communities. So we'll be developing modules for this program on things like substance use, human trafficking, healthy relationships. The communities will pick the modules that are important to them. The program includes an influencer component, so we recognize that as an organization that might be new to Indigenous people, it helps to have a trusted face make that introduction. So for the first introductory session of the program, Jordan Tutu, the former NHL player, who has firsthand experience with suicide in his family, he starts the session by talking to kids just about how important it is to reach out, and he introduces us to them to Kids Help Phone. And that leads into the session, and there's activities and things like that. So we will be starting by offering this program between now and March 31st in every Inuit community in Canada and First Nation communities across Ontario and in a few regions across the country, but it'll be available to everyone as of April 1st. So I think I'll wrap it up there so we have some time for questions. Shall I hand it back over to the moderator?
Thank you so much, Deanna, and also thank you to Elisa as well. Such wonderful presentations and such a depth of information that you've provided to our audience. So I really do want to thank you for your time and open it up for question and answer period. We would like to remind you that for your questions to be addressed, you must first type them in the chat box. Please feel free to ask your question in the language that you prefer. And for ease of reference, please indicate which speaker your question is directed to, or if the question applies to both speakers. It is possible that we may not be able to answer all of the questions that are being asked today. If that's the case, please feel free to email your questions to our colleague Ryan Murphy. His email address will appear in the chat box as well, who will then work with the speakers to get those questions answered. In addition to that, if anyone would like to reach out for support, they can text the Kids Help Phone texting service at 741-741. So I wanted to make sure that that's also provided to you. I do think that when, Elisa, you were presenting, a couple of questions had already come through. So maybe we'll start with getting those answers, and then also ask for other questions. So the first question that came through was, can you comment on why an adult would access the services? Is that an adult who is worried about a youth or supporting a youth?
That's a great question. Thank you. So the reality is that prior to us beginning the all ages texting service, there was no 24/7 texting service available for adults, and many helplines that do service adults have long wait times to be able to call in, for example. And so what we started noticing was that a lot of adults were texting us, and they were starting with, "I'm sorry, I'm not a kid, but." And we realized that we had a huge amount of capacity because of the volunteers that we had trained and our ability to virtually train large numbers of volunteers, that it made sense to just open up our texting service to adults. So the vast majority of adults that are texting into us are texting in about their own challenges that they are facing. There is a small number that do text in about supporting young people in their lives, but the vast majority are talking about the impact of COVID on their lives, the distress, suicide, all of those issues that adults across this country are facing. And our trained crisis responders are trained to be able to support those adults in a similar kind of way, doing active listening that we do with young people.
Wonderful. Thank you. I think another question might apply to you as well, Lisa, is does the Data Insights page show the most popular time that youth are connecting with Kids Help Phone?
Yeah, so if you go to the Insights page, you are able to filter in a few different ways, and you can filter by issue and time of day. So you can see for each month. So right now the data up there would be from the month of December, and you can click on whether it's suicide or bullying or anxiety, and you can see the day of week as well as the time of day that young people are most reaching out to us about that. You can also look at ages. So you're able to filter that data in a lot of different ways. As I said, version 2 of that, which we're looking at designing over the next few months and launching later this year, we're hoping to have real-time data, so it's not last month, but potentially last week or even yesterday, as well as being able to show trends so that you're able to see how are things changing over the course of time with the people reaching out.
That sounds wonderful. Thank you. I'm wondering if this particular question is probably open to both yourself, Elisa, and Deanna. Is it possible for a community to know in their own region who has been, if youth have been accessing the Kids Help Phone helpline service, and for them to understand the level of social distress and the specific needs of their community, obviously without sharing details on the individuals, but just sort of to get a general sense of what kind of support has been needed in their community and what are their specific needs. Is there a way to engage with Kids Help Phone to learn more at a community level?
So it's a great question. I will answer part of it, and then Deanna definitely chime in. So at Kids Help Phone, traditionally, we really only looked at our data from a provincial level in order to ensure that we were protecting the anonymity and confidentiality of young people, but also equally important that we were not doing anything that would make any young person afraid, because perception is just as important as the reality. We don't want them to think that their data is ever shared or that they could be re-identified. In the last few years, we have started to break our data down to communities at different times. So I was looking at the data, for example, for Ottawa the other day, and I saw that since school closed, our conversations in Ottawa have gone up than any place else in the country except for Victoria, BC, percentage-wise. So we can break it down by some communities, but we're also very, very careful about not breaking it down to too small of a community because of the fear of the ability to determine who it was that was reaching out to us. So we want to make sure that we have a large enough population that we're able to make a determination without there ever being an ability to identify somebody.
I can expand a little bit on this because the way we approach data with Indigenous people is different from how we approach it with other data from other people in Canada. And that sometimes when we're talking about communities and sharing information based on the community, Indigenous communities tend to be much smaller. So if someone were to give identifying information, certainly we wouldn't share that. So we're looking at sharing data back to regional, at a regional level, so across each of the 4 Inuit regions and each of the provinces and territories. But we want to be as specific as we can. So when we develop this data policy, we may say, okay, 10 people reached out from this community, and we do have the capacity to do that in terms of text service. But it may only be the number of people who reached out. It might not be the issues. So we'll have to work with Indigenous leadership to identify how we're going to share data in a respectful way that protects the anonymity of the people who are using our services. And that's something that we hope to have in place by the end of 2021.
Thank you so much. This is absolutely wonderful information to get. I think the next question we have is for yourself, Deanna. Is there a plan to reduce the Kids Helpline to a shorter number, like a 3-digit? There's been conversations going around that a youth was trying to advocate the change in helplines for youth, kids and youth. Maybe perhaps it's for Deanna and Elisa, both yourselves.
I'll pass that over to Elisa.
Sure. So yes, there has been a lot of work across Canada, and there was one young person that was really amazing this desire for a 3-digit number. It has since gone through the House, and they are actively looking at this, and so we are part of a lot of conversations, particularly around suicide. How can we get a 3-digit number that people can quickly connect to for suicide? The U.S. is also engaged in this work there, and I would say they started a few years ago. It does take some significant work, so I would say stay tuned. We are very, very interested in ensuring that it is as easy as possible for people who are in any way thinking about suicide to connect. The 3-digit number is really important to that. Another thing just to make sure everybody knows about that just launched in Canada a few months ago is, at least in English, as of a few months ago, anybody that is on Google and puts in keywords about suicide immediately gets what we call the one-box solution, which has one phone number and one texting number for them to connect to. And the texting number is the Kids Help Phone crisis text line phone number or text line. And again, that's in order for people to not be Googling and trying to find a local number or spending a whole bunch of time. If they're Googling about suicide, we need them to quickly get the phone number and the text number. And then I think another big thing for us to work on in the coming years is to be able to get that 3-digit number as quickly as we can to make calling as simple as possible.
Oh, thank you for sharing that. That's definitely a new development to take note of. The next question is for yourself again, Elisa, is that you mentioned 100% increase in usage in the past sort of 5 years. I believe that number was shared more from the perspective of the suicide issues that were coming up. Can you identify how much of this increase is due to public and Indigenous knowledge of Kids Help Phone, and what percentage is due to increased need?
Yeah, so that's such a good question. It's really hard for us to tease that out, to know whether or not people need us more or whether or not we're out in communities more. I would say it's probably a combination of both. Certainly Kids Help Phone measures our awareness across Canada, and we're constantly working for how do we ensure that young and every caregiver, every teacher knows about us and is able to refer to us. And at the exact same time, we are seeing that young people are reaching out with more significant and serious issues. And then we also see real differences by region across the country. So, for example, when I look just last month in December, certain provinces were over-indexed, which means that they were speaking about suicide the average nationally. So Manitoba, Saskatchewan, Alberta, BC, and Newfoundland, those people from those provinces were reaching out and talking to us about suicide more often than the national rate. And so we also are looking at how that need grows and changes in particular provinces. And as I said, at the same time, we want to make sure every community knows about us. And that's why the work that Deanna's leading is so critical to building the trust and the partnerships and the relationships, so we make sure that Indigenous youth see us as well as other places as go-to places that they can receive support.
Thank you so much for that. The next question is we have for Deanna. Do you find that Indigenous youth use the program in communities that are not primarily Indigenous? Someone was thinking of Southern Ontario as an example.
Yeah, that's a great example, actually. So one of the things one of the actions in Finding Hope is to develop a mapping tool where we've actually mapped out every Indigenous community in Canada, and now we're starting to kind of overlay data to make sure that we're reaching every corner. And we haven't inputted all of the service user data yet, but what I can see anecdotally is that it's very heavily concentrated in urban areas because we have a lot more awareness there. So now we're doing things like someone just asked about Manitoba. I saw we're actually still doing it for 2 months. We're doing a Facebook campaign in Manitoba to increase awareness there, because when we promote the services through Facebook, people can link right into the Facebook Messenger window. But we're targeting communities and not the urban centers in this case. And it's not to say that the Indigenous urban communities aren't important. It's just from what we can tell, awareness is much higher in urban centers. So we're concentrating efforts in more rural and remote communities.
Okay, thank you, wonderful. Another question coming to you, Elisa, is if we anticipate a further surge in mental health crisis in the coming months, as it has already been predicted, how do you anticipate you'll be able to respond to the increase in demand?
Yeah, so it's a great question. I think that so many organizations on the front line, we have been seeing huge demands for our service, which does require that we are constantly thinking about capacity. And one of the reasons that you'll hear us talking a lot about our texting service is because we built that service specifically to be able to quickly grow to respond to demand. So our counseling service, which is phone, we have paid professional counselors, and we are able to bring on new counselors, but it does take a while to be able to do that, and it takes the funds to be able to do it. With our texting service, it's using trained volunteers who are overseen in real time by paid professionals. And when COVID began, we put a call out across Canada to say we needed more volunteers. At that time, we had about 700 that were active with us. We had over 9,000 people respond to join Kids Help to become one of our crisis responders. And so we very quickly trained people. They're now at 2,200 volunteers, and we still have a list of women to be trained. And so for us, the capacity is about being able to quickly train people. Now, when I say quickly, it doesn't mean that you have to reduce your quality of training, but all of our training is remote. It uses AI so that people are practicing, and we use live people to both grade things and to give feedback. And so we are training right now about 150 people every 3 weeks or so, which allows us to continuously bring on new crisis responders to be there as we see these large increases in demand for our service.
That is absolutely amazing, going from 700 to now 2,200 volunteers. I think that really does speak to the capacity, but also the demand that we need right now in our country. A question coming to you, Deanna, is what lessons can other organizations learn from your approach to supporting Indigenous youth?
It's a big question, so I'll answer with what I would start with, which is ensuring that you have Indigenous representation on your board of directors and in leadership roles in the organization. And listen to Indigenous people who are experts in their own lives. You know, we as Indigenous people know what's best for us, and you know, really embracing Indigenous leadership is essential to the success of any program supporting Indigenous people.
Thank you, and what a wonderful question. I think when it comes to serving and working with Indigenous populations, we just have so many learnings that we can learn from one another, so all the experiences are valuable. Question for yourself, Elisa, is do the kids who call in make up any specific mention of struggling with the impacts of COVID?
Yes, so certainly we have been tracking conversations about COVID since the pandemic began, and we have seen those conversations go up since March, and then we saw it kind of come down wave. We have seen those conversations increase again as we have seen school lockdowns and a state of emergency in Ontario. But the reality is that young people are usually talking about COVID and something else. So for a lot of young people, it's COVID in school and the impacts of those two things. For others, it is about the sense of isolation that they are feeling, the fear for their future, a lot of grief. A lot of young people are experiencing grief right now about things that they're missing. And so, yes, we are specifically tracking COVID conversations along with how COVID connects to the other issues that young people are talking about.
Thank you so much for that response. And I think another question coming to you is from one of the partners who have their services listed on your website, and they're asking about how they go about updating that list to be a more updated and recent list on your website. What would be the process for them to reach out?
That is also a great question. So if you are on our resource list, which you can know that by going to kidshelpphone.ca, and at the in the first part of the website, you'll see something that says resources around me that allows people to find a youth program near them. And if you either are on there but you'd like to update it, or you are not on there and like to add the service that you have, you can reach out through Kids Help Phone's website. We have a Contact Us button. Or I would say you can always reach out to either Deanna or myself, and we'll make to get connected to our group of library specialists that keep that resource list up to date.
That's wonderful. Another follow-up question I want to ask about sort of for low-income youth that don't have the ability to connect via internet or via phone, is there a way for them to reach out?
Yeah, so it's a really interesting and important question. One of the things that we have seen in the past is that a lot of young people would access our service from things like schools and libraries. And with any of those closed, it does become increasingly difficult for young people that don't have access to some kind of technology to reach out. We are of the international movement for youth helplines, and certainly have looked at how some other countries have provided services that do not require technology. For example, some have a service where you write letters and you receive a response back. Right now, the vast majority of our focus is technology, although I would say part of what we're looking at is how do we create different entree points. So if you don't have bandwidth, you can still connect. If you don't have cellular coverage, still connect. But we also always need to be thinking about those young people that potentially have no technology available to them. And this time during COVID make much, much more complicated because they don't have it in the home, and they also don't have access to those places where they might be able to connect via technology.
Okay. So this is the last question for our webinar today, and it goes to both yourself, Elisa and Deanna. Where are the volunteers located, and are the Indigenous volunteers urban?
So I can just say in general, and then Deanna, yeah, you definitely chime in. So in general, we do have volunteers from every province and territory that volunteer from us. The thing that they require is we require that you be age of the majority in your province, that you have a stable internet connection and privacy, and go through and pass our training, which is all online. And so we work very hard to have a diversity in ages, groups, languages, so French and English. But Deanna, I'll let you talk a little bit about that diversity as it relates to Indigenous volunteers.
Mm-hmm. They're all across Canada, urban, rural, and remote. In fact, our Indigenous Advisory Council, 4 or 5 of them, of the council members are also crisis responders. So, and applications are still open only for Indigenous crisis responders to support this initiative. So you can volunteer as an Indigenous crisis responder at kidshelpphone.ca/findinghope.
Well, thank you so much to both yourself, Elisa, and Deanna for answering. I think we've got a flood of questions, and I appreciate that I don't think we could get to all the questions today. However, as promised, we will circle back with you with those answers, and a member of our team, Ryan Murphy, will be doing that. I really want to thank you again, and thanking for everyone to share your time together with us and learn from Kids Health Phone and their expertise, and also be so engaged and interactive in asking your questions. This webinar was very, very informative, definitely to myself, and I think will contribute to our collective efforts to offer comprehensive approaches to suicide prevention in Canada. Thank you so much for attending today, and we hope to see you at our next webinar.
This concludes today's webinar. Thank you, everyone. You may now disconnect.